Today, let's talk about the similarities and differences between a fluoride toothpaste and a hydroxyapatite toothpaste. Now, both of these type of pastes are designed to protect your teeth from cavities, and they do enhance tooth remineralization. Now, fluoride, as you know, does this by taking the fluoride and combining it with calcium and phosphate ions in the saliva to make fluorapatite, which is very acid resistant, and it remineralizes the tooth structure. However, the problem is that if you have a patient with a very dry mouth, that remineralization may be hindered because there's not a lot of calcium and phosphate ions in the saliva reservoir. Hydroxyapatite, on the other hand, it actually mimics the natural mineral tooth structure of the tooth, and it helps to remineralize. It can fill in tiny cracks in the tooth structure. And the cool thing is that if you have a patient with a dry mouth, you do not need saliva or the calcium or phosphate ion reservoir in the saliva to remineralize the tooth structure. So this may be beneficial for your dry mouth patients. Now, the cool thing is that fluoride and hydroxyapatite can work together. So if you have a patient that has a high risk for caries, you could consider combining them, such as a hydroxyapatite toothpaste and a sodium fluoride mouth rinse. Now, whatever the case may be, I always recommend taking a look at what are your patient preferences and what are their individual needs, and then making some recommendations for a toothpaste based on that. But considering the general North American diet can be highly acidic, I always recommend having a remineralization agent like fluoride or hydroxyapatite in their daily toothpaste.